Welcome to Med Talks. Remembering Dr. K.K. Agrawal, who is one of the greatest man of medical science dissemination, will start the chat show today. And today's topic is Doxycycline, a secret weapon for physicians. So for the talk, I request welcome Dr. Davinder Tulpule. She is a MBBS graduate from Jaipur. Then she has done internal medicine from Belgaum and 21 years in the practice of internal medicine. Almost 15 to 16 years she spent in Great Britain, where she was working in the emergency medicine as well as internal medicine. And last 6 years she is in Mumbai Wockhardt Hospital as well as a couple of charitable hospitals. She's dealing with OPD, she's dealing with medicine ward, as well as she is dealing with ICU sector. So I think let us start the discussion about the topic is very good, doxycycline secret weapon. So I will start with the first point like weapon, because antibiotics are weapon for clinical practice. So in your clinical practice, what do you feel that doxycycline is a weapon for what are the different bacterial illnesses?
Well said, Dr. Abhankar. First of all, thank you for inviting me on the talk show and my condolences to the whole Agarwal family. Well, it's a good question to start with. We see a lot of antibiotic resistance these days, and the past, I think, 1 or 2 decades, the resistance has been coming up. So as you said, yes, it is like a weapon, because a lot of times when other antibiotics have failed and have been used for over and over, and patient comes to us, we get the blood test done, and we see a list of drugs that resistant. There, I think such a medication, which is a tetracycline group, which is a really good drug, doxycycline, has come up really well, because I think it has a low potential of having resistance yet. And if used well, I think we can go a long way with doxycycline. I totally agree there. And in my practice, I am using it, especially the time when I use it most is in the monsoon, when I have pneumonias and when a lot of people wet in, leptospirosis is suspected. So I tend to use doxycycline with my patients, and they've shown good response.
Yeah, I think as you are talking about that it's a weapon for respiratory tract infection as well as the other infections.
Yes.
So survival of the fittest, right? So when the bacteria started coming, that the human beings started making antibiotics because we have to control bacteria. And doxycycline like weapon is very, very important in our all clinical practice. Now you may be using multiple antibiotics, but in terms of pharmacological properties, because what pharmacokinetics or dynamics, how the doxycycline makes a very suitable choice for all of us.
Well, doxycycline is certainly one of a very superior medications. Number one, its gastrointestinal absorption is excellent, and because most of it, 93% is plasma protein bound, so it gives us a nice, kind of dissipation of medicine into the system, human system. Secondly, I would say that being, it's a lipid-soluble drug, so therefore, even in infections, the CNS penetration is quite good. Then on top of that, obviously, we tend to use it just once a day, which is, for the patient to, kind of limit themselves to multiple drugs. They always want something which they need to use least. And another point which I must point out here is that in case of, when we have patients who are in the ICU or who've got CKD, in those patients also, when we're using doxy, we don't really have to reduce the dose so much, because even in CKD, it can be excreted from the feces. So a lot of, kind of load goes out there, and the brunt on the kidney is much less. So it's quite a good drug that way. So that way, I can say that it's really favorable in a lot of.
Yeah, I think that means that pharmacokinetically it is a very smooth antibiotic. So I think
and the serum, and I forgot to mention one more thing. The serum half-life is quite good, 18 to 22 hours, which gives us a window that we can use it once a day. I mean, that's quite a good thing for any medication.
Yeah, I think absolutely well made point. I think pharmacokinetics as well as dynamics definitely suits doxycycline is a relatively very good antibiotic. While selecting an antibiotic, one of the very important point what we look into in the practice is the spectrum, right? So the whether it's a broad spectrum, narrow spectrum. But I think if I analyze doxycycline, there is no term, but it is like broad and broad spectrum kind of thing. So
yes,
can you tell me what is the different spectrum it covers? Yeah, which is very relevant.
Yes.
Yeah.
Certainly, I do agree there. It does cover. It's a broad spectrum antibiotic. It covers a lot of gram positive and gram negative bacilli. And if we talk about that, I think it covers Staph aureus and Streptococcus pyogenes, which, I mean, a major cause of chunk of illnesses and infections come from there. And then, there are other non atypical bacteria also we're looking at, some protozoa we're looking at. So actually the spectrum doxycycline gives us it quite a wide range, but we need to be careful to use this drug very carefully, because it is a really beautiful drug to use. But obviously we need to keep our minds in, kind of open that, yes, we have this molecule, we need to use it, and it's got a broad spectrum. We can use it in we can use in upper respiratory tract infection, we can use in ear infection, urinary tract infection, we can use in various illnesses. So basically rickettsia, spirochetes, you name it, and you can use it well.
Yeah, I think if you look at the classification of antibiotics, there are certain antibiotics who are specific for gram positive, or
Yes.
certain they are very specific for gram negative, or the some are only good for atypical bacteria, right? So anaerobic, like metronidazole only for anaerobic. So that
Yes.
but the relatively the even in the cephalosporin classification, the first generation is better for gram positive. Then you go to third generation, it is better for gram negative. So that change in the classification based upon antibiotic classification, the difference is there. But I think doxycycline is one of the antibiotic. Definitely, it is a truly broad spectrum. So the physician
Yes.
should not worry while selection in the practice, which are, because that is a clinical dilemma in our practice. Because nowadays, previously we are sure that when we get a respiratory tract infection is surely as pneumonia. That was such a surety was there. But do you get such a surety now in the practice? It's
No,
only one.
what happens is, I would say, yes, back in England, we used to have that, okay, the most common pathogens will be there, and we have set guidelines that we have to use these medications. But practicing in India now, I see that there are a lot of patients have been already been put on medication by various doctors outside in the periphery. So I don't have the thing that, okay, I'm looking at Streptococcus pneumonia. It's not sure. So one has to keep the mind and their spectrum open, their mind open, to see whether you're looking at this, it could be this, it could be that. So I wouldn't say that yes, I'm 100% certain. Majority of patients might be, but then there are some 10-20% who will fit into the other category.
Yeah, I think that's exactly the point where we have to be really watchful that the bacteria can be any bacteria nowadays. It's not like that only one specific one. Even in the urinary tract infection, we may not get E. coli sometimes also, right? It may be a
Yes.
common bacteria, but still we are
Good
getting
feedback,
other
Sheila.
bacteria, right? It's very very crucial. Otherwise, previously UTI means 100% E. coli was that was the principle. I think 10,
Certainly.
20 years back, but I think today the scenario is
And
different. That is happening
it's
with each
very
and
different.
every, yeah, each and every
Yeah.
infection. So therefore, the true broad spectrum antibiotic like doxycycline definitely has got a role in the practice. Now, another important point, the word which I have kept aside is like a secret. Now, why the secret is there is because I think you started your talk with antimicrobial resistance, and that exactly what we are seeing in the clinical practice. Because the patient is coming with one infection, already received some antibiotic, not resolved after 5 days, again it is getting aggravated. We send a culture to the sample, and the culture is showing whether it is a urine culture, sputum culture, blood culture, and there are out of 20 antibiotics, it is resistant to 17 to 18. So this
Correct.
is a picture what exactly we are seeing. So I think in your practice, what do you think that antimicrobial resistance in general settings in your practice?
No, the resistance here, at least in India, is quite high. I think that is why WHO has also made this classification of the aware, classification where excess antibiotics are available for us to use from that group of drugs which we should use. But one thing which I would like to put forth here is that unless and until really it's necessary, the patient should not be on antibiotic. And if they are, and sometimes they don't, patients also don't, lot of times the antibiotics are given, you have to take them 3 times a day or 4 times a day. They don't really stick with that regime. So where these kind of things happen, the resistance goes even high. The patient also is not compatible with the drug regime which we have given it. So in that case, I would say this is like a secret weapon where you have a 5-day course, you have once a day tablet, and that's it. It can be given orally, it can be given parenterally, and the problem is solved. Yeah.
Yeah, I think on the Medline, if you put it antimicrobial resistant India, you are now getting numerous references and
Yeah.
across the each and every sector, right? So it's not like only metro cities, even in the rural areas also, not in the hospital setting, even in the private settings. So
I think
antibiotic
it's worse
resistance
in
is,
rural areas. It's worse in rural areas because there's no regulation of antibiotics. One is using anything and everything. So they will try one thing, then the other thing, then the third thing. So that is giving rise to resistance. And using antibiotics every 15, 20 days, 1 month, obviously will put in into resistance.
yeah, I think one of the point which you have mentioned is very nice. It is a access group of antibiotic as per the WHO policy, that the
Yes.
antibiotics which have got really a wide range as well as less resistance. Now they have to be accessed very fast, right? Otherwise, some antibiotic has to kept as a reserve, right? They don't use in the practice. But I think
And I think
doxycycline.
doxycycline falls in a very, it's not very expensive drug as well for pocket, for pocket use. It's not very expensive drug. So it's quite, it's a regime which can be followed once a day, not very expensive. So it takes the point there actually, the star.
I think this is one of the very important point. I think the pharmacoeconomics is creating a very huge problem in Indian settings, and I think after this COVID pandemic, there is a lot of financial turbulence. So people opting for costly medicines, then I think
No,
they
they
don't
can't
purchase the
support.
second strip. Yeah,
No, they won't. Yes.
first strip they take, and then I think second strip they don't take. What do you feel?
Exactly, because they don't want to stick to very long. First of all, people in India don't like taking many medications. And then if you tell them you take this antibiotic 4 times in a day, so which means that they have to get up in the middle of the night also and take. So there are something like don't take this time, don't take that time. So they after 2 days they say forget about it. I'm okay like that.
Yeah, I think so. I think antibiotic resistance is one of the critical point for selection of antibiotic in the all settings. I think it is OPD as well as wards or ICU.
Yes.
You were mentioning about in the monsoon. I think pneumonias. I think all people are got educated on pneumonia because of COVID, right? So nobody was knowing about CT scan for lungs or CRP as a marker. So I think
Yes,
pneumonia.
yes.
Yeah, pneumonia is one of the
Certainly.
indication of respiratory tract infection. I think all the guidelines are mentioning doxycycline as the first line, but in the practice we see something different. So, what is your experience in doxycycline in the respiratory tract infections?
So I would say yes, respiratory tract infection, community acquired pneumonia. According to the CDC, the American guidelines, it says you can use doxy if you're not using macrolide, and if you're not using beta lactams, then doxycycline is the first line drug after these two. I mean, if you're not using macrolides, you can use. And COPD, yes, it's very beneficial in patients who keep having chronic obstructive pulmonary disease and they come with regular bronchitis every 2 or 3 months. They land up into your clinic or in the hospital with lung infection. In those patients, also doxycycline plays a good role, and I have used it and with good results. Other than that, I have upper respiratory tract infection, chronic sinusitis, acute and chronic sinusitis will also be, it's helpful to use in that cases as well. So I won't deny that community acquired pneumonia, you can't use it, you can use it. If you're not using macrolides or a person is resistant to macrolide, then you'll have to go to doxy.
Yeah, I think that we have seen phenomenon because the macrolides are used in as a in and out antibiotic by each and every even from the lower down family physicians, right? So
Yes,
there
yes,
similarly cephalosporins, first generation cephalosporin, they are used so much widely, and even
totally.
levofloxacin, which is actually a respiratory fluoroquinolone. But these antibiotics are so commonly that rampant use of these antibiotics because a lot of patients come to you are refer, right? So what do you feel?
Yes, yes. So they've already been on multiple medications for 2 to 3 days. They've taken one antibiotic, then shifted to another, then gone to another doctor who's given them something else. So then they land up, and I have to start from scratch. So I start by getting their if they've off the antibiotics for a few days, and I start with blood cultures and start again with their bloods and see whether they really totally need some antibiotic, and then I decide, okay, the culture report is also out by then, 2 3 days. We tend to decide then which antibiotic is most suited. So I see what they can really afford and how it would be best to make them adhere to the treatment, at least first of all.
Yeah. So I think respiratory tract infection, doxycycline definitely, as you have mentioned, that in the guidelines also it is recommended. In the practice also it is useful.
Yes.
Yeah. The another important element about antibiotic is the allied properties. I think one of the allied property which is talked is the anti-inflammatory action because the body also reacts to bacteria, or now we are talking about virus or even fungi, whatever we are talking. So the body reacts, the immune cells, WBCs, they react, and during that process, they release a lot of inflammatory mediators, and that they cause damage. So I think, what is your experience? What is your doxycycline as an anti-inflammatory drug? Yeah, because it's a
Uh,
well-known anti-inflammatory drug. Yeah.
Yes, so in the recent past, this anti-inflammatory properties of doxycycline studies have come up, and I've been going through them. Certainly, it has anti-inflammatory. There have been studies which have shown that it has anti-inflammatory properties. It does down-regulate the cytokines and the chemokines, which are part and parcel of causing your cytokine storm or severe reactions or septicemia, something like that. And also, it also inhibits quite a few important proteases like metalloproteinase and those kind of things. It's inhibiting, so the prostaglandins do not come into picture, and the inflammatory response stays low. But having said so, I think it quite a few studies have shown, but I would still say we need more data into it. And certainly it has anti-inflammatory properties, and this is why perhaps, as you said, that in I'm practicing in Mumbai, Maharashtra, Mumbai. So basically, here in COVID, quite a few doctors are not using doxy, but I'm seeing, because I was seeing patients online in northern side of India, it is being used commonly in mild and moderate cases, for the simple reason that maybe the physicians there consider the anti-inflammatory effect as well into picture. So that's why they want to perhaps stop the patients getting into serious COVID complications. So they're probably using this one, or maybe azithromycin along with it. So I was actually wondering why are they using, but I think it's because of the anti-inflammatory property that it has taken this show, that in the COVID people are using because of anti-inflammatory properties. And there are other illnesses also in which they have used doxycycline. It is coming up, like in see in dengue also, it stops the viral replication, so it is said in studies, but I think we need more data into it.
Yeah, I think, since you have taken the topic of COVID from the bacteria, we can move to COVID. I think COVID are definitely that mild to moderate illness initially, and then once it becomes moderate, there is a lot of inflammation. And you have also mentioned about cytokine storm. What we are actually seeing in influenza, especially in the pediatric population, there was sudden increase in pneumonia. So here also the similar picture is there, but it is in more severe. Cytokine storm is huge, and it has to be controlled by steroids. So that kind
Certainly.
of a severity, yeah. I
Yeah.
think there, as you have mentioned, that the doxycycline and azithromycin, because these are the classes which have got really anti-inflammatory property. So I think, are you tried in some patients doxycycline? Yeah.
Dr. Abhankar, the thing is, ICMR guidelines here do not recommend doxycycline or azithromycin or any other medication according to the ICMR guidelines. So I actually have not yet tried with my patients doxycycline. But what I'm seeing is that my patients who are from the northern part of the country, they have been on. So I respect that. It's okay. Maybe the guidelines in Delhi and Punjab and all are slightly different than what guidelines we are following here. So if we are getting results, that's what I said, that perhaps we will have to do a study based on at least 50-50 patients in which we take, and then we come to a consensus that, okay, this is the data we are getting. Some patients who were not on doxy, who were mild to moderate or maybe moderate, some were on, and so this is how we can compare. But I certainly haven't used it here in my practice for COVID
Yeah.
patients.
Yeah, absolutely right. The experience from doctor to doctor is different, definitely. Because that
Yes.
initial mild to moderate, I think inflammation control, that hydroxychloroquine, azithromycin, doxycycline, ivermectin, so all these compounds, basically, they have got repurposed, I think, right? So,
Yes.
yeah. So, can you share experience of repurposing of drugs in the this era, COVID era?
I think repurposing, as we use the term, I think most of it has to be. I wouldn't say in COVID now resistance has come up, but I think somewhere down the line it has come up that some of these, like as you talk about doxy, doctors have known about its anti-inflammatory properties, and I think certain group of doctors might have got together and decided that, okay, we are going to start using doxycycline as an anti-inflammatory in COVID, whereas ivermectin is a weak antiviral. Although ICMR is saying again and again, please do not use, but I think it is also left to the discretion of the treating physician.
Yeah.
Azithromycin also, again, it's an antimicrobial. So because doctors want to stop patients getting into hospital with severe complications, they are tend to using it. You start using these medications earlier on so that the patient. So I do not know where it has started coming from, but if you ask me, the repurpose is maybe because of this. There have been some studies all over the globe. Maybe people have found that ivermectin was useful, so they have started repurposed it. So I think this is the way it has repurposed now
Yeah, I
other
think
medications.
once the in a if it is a if it is it might not be an epidemic, then repurposing might not happen if it is a selective cases. But now
Certainly.
it is huge cases, so the doctor doesn't want to give the patient only on vitamins, or
Yes.
the clinician is not going to he is going to experiment himself. And as you have mentioned, absolutely right point is that doxycycline is so widely used. The doctors have a lot of confidence on the molecule, and they are known in anti-inflammatory properties. Therefore, they may be using in the COVID patients. So as an antibacterial, but I think useful in the COVID. But even if you go to other diseases, I think the malaria
Yes.
or dengue, I think there it is used. So that
Certainly,
can be,
certainly. That is age old now. It's be all, yeah, that is established fact now that, okay, prophylaxis of falciparum malaria, we tend to use it. Even I was reading that there was something point I wanted to make here, which is certainly slipped out of my mind right away. Um well, if I remember, I'll say it. There was something on my mind. So yes, malaria, it is being used, and even in dengue, a lot of I was reading literature on dengue and doxycycline use. I think patients who are going down hemorrhagic fever, a lot of physicians have tried a trial of doxycycline that time to see whether the anti-inflammation. Again, it's all about leading those, pro-inflammatory markers, the cytokines and all,
yeah.
just to get the interleukin 1 and 6 down and well in control.
Yeah, I think you are rightly told that in malaria as well as dengue, because quinine plus doxycycline or artesunate plus doxycycline, this kind of
Yes.
therapies were used when the severity is relatively very high, because the two drugs having different modes of action. I think once you talk about mode of action, I think antimicrobial resistance with doxycycline is relatively less. What is your
Yes,
opinion about it, right? So
yes,
what are
it
the
is
features?
certainly
Why is
less.
it less? Yeah,
I think one thing could be that maybe the molecule itself, because it acts on the 30S ribosomal unit. Number one could be that. Number two could be that it's not so rampantly used as doctors or physicians or RMPs are using other medications. As we were saying, they're using macrolides, they're using beta lactams, they're using azithromycin so much that I think doxy has probably escaped the thing. This is why I was saying earlier that since we have a good molecule with low resistance effects, we need to be very careful about this one's use, so we can save it for a long run.
yeah. So I think absolutely right point, because the mode of action is very important because the bacteria is not able to identify the mode of action or how to cause the resistance is very
Yes.
critical, right? Because the cephalosporins are definitely immediately or macrolide resistance is there, and even now you are seeing COVID having mutant, so that means it is developing its survival of the fittest. So I think a
Yeah,
very
so the
unique
point I was
mechanism.
trying to make earlier was that, as I said, the ICMR guidelines, I have said that they haven't included this medication. But what if you had noticed from last year, ICMR guidelines are also changing every six
Yeah, they
months.
are.
So you never know. Yeah.
And as hydroxychloroquine, initially they put, but abroad people
Yes.
are not accepting it, right? So
No,
it's
they're
not.
not
It's
accepting.
see, I think clinical discretion is very important because the doctor is practicing in that area for so many years. He's seeing so many patients. He has used, I think, experience of 20 antibiotics. So whenever he is seeing that there is a risk, and he wants his patient to get benefit. Ultimate objective is that.
If you
That he,
ask me, I would say that I wouldn't, in a COVID patient, I would not use, but I would also think that, okay, if my patient has got pneumonia or is in early stage, why not use it?
yeah,
Why
that's
not
okay.
give them benefit rather than hold them back? Because it's only once a day, it's inexpensive, it's got very less side effects. So we get at least three benefits out of that.
Yeah, absolutely. And even I think one disease you may be knowing that arthritis also there are studies available. And this
Yes,
chikungunya arthritis or even dengue post arthritis and even simple arthritis, non-specific arthritis. The data about
nonsense.
because it's a pure anti-inflammatory property which is making a difference. Right. So I think overall these are the pointers which are very very critical. But in terms of duration, I think I know that you are telling the duration might be 3 days, 4, 5 days. Have you
Yes.
used doxycycline for longer time for any conditions?
Only in patients who are in the ICU, we've gone around 10 days, I think, but otherwise, no. 5, 7 days is more than 5 days is more than enough.
Yeah. So
ICU patients, sometimes severely ill patients, yes, we tend to stick a little bit longer than 7 days.
in the ICU, and which are the conditions where you are putting doxycycline along with other antibiotics?
It's mostly it's pneumonia, or it's leptospirosis and its complications, something like that. I remember last year I had a patient with H1N1 and who landed up in pneumonia, and I gave them doxy and they really improved. So that was not even last year, it was I think 3 4 years back. But yes, mostly pneumonias and upper respiratory tract infections.
Yeah, there are questions have come from the audience also, that can doxycycline has got any role in dermatological disorders or gut related
Yes,
any problem?
certainly. Yes, I think it has a role in acne and rosacea. But I think studies have shown that can be left at the discretion of the treating dermatologist. But I think low dose doxycycline does help in acne and rosacea.
Yeah. And there, I think that pulse therapy also, I think it is used. Most probably, it is given for some period of time, and yeah.
Yes, yes.
So, when a dermatological disorder also, acne, there is definitely a role of doxycycline in the case
Yeah,
of acne.
rosacea also it's been mentioned, so it
Yeah.
should be.
Another, yeah, another question which has come, that is it safe for pregnancy?
Yes, it's quite safe for pregnancy, actually. Doxycycline can be used in pregnancy, but I'll still have a look. I'm not 100% certain, but as far as I remember reading the literature, I think it is safe in pregnancy.
Okay. So I think the very important point is that the broad spectrum nature of the drug, I think antibiotic resistance risk, which is relatively less. So final comments, what do you want to make on this word secret weapon? Because if specifically we are use this as a drug which is a choice for multiple indications. Yeah.
Yes. So my suggestion or advice would be, or rather, I would just say that basically we have a good molecule for us to use, for us physicians to use. It is inexpensive, has less side effects, and it is just used once a day. So let's be very careful in using it so we don't lose this molecule also to the game. We don't really have resistance to doxycycline, then we don't have many molecules like this which have got broad spectrum, which are it can be used in positive, gram positive and negative, and spirochete, rickettsia, and you name it. There are quite a few indications where it can be used. So let's be very careful in using, and use it very carefully, and let it go a long way.
So I think it is a very good discussion on the molecule doxycycline, which is used for I think more than many decades. We all are using in the practice. Our confidence on the molecule is definitely there. The
Yes.
spectrum is very broad. I think Dr. Davinder has clear cut told that in terms of spectrum, I think there are very few antibiotics which have got such a broad spectrum. So I can call it as like broad and broad, covering gram positive, negative, some anaerobes or atypical also, and non-bacteria also. I think that is another important point. And you
Yes.
already emphasized upon, yeah, non-bacteria, even malaria, and guidelines are recommending. That is very important.
Yes.
The pneumonia guidelines are mentioning American as well as British. The malaria guidelines are mentioning, and the anti-inflammatory property. I think if you only, I think the macrolide group of antibiotics and this tetracycline and especially doxycycline. Now these are the category of antibiotics. They have got some anti-inflammatory action, because cephalosporin doesn't have got, or
No.
the penicillin category they don't have got. So apart from the antibacterial, anti-inflammatory property, it's like mild steroid. You can mild steroid, right, along with antibiotic property. So this is, I think, in the practice it will be used. And the madam was rightly, Dr. Davindra has clear cut told that in terms of pharmacology, it is so good that in terms of dosage convenience, uses in multiple population. So I think the as the name is suggesting, it can definitely become a weapon for many different indications, and especially I think respiratory tract infections, pneumonias. That will be a very important. COVID-19 is a pandemic which is going to remain for next 1 year. So if you are in a mild or moderate cases where you feel that we have to stop anti-inflammatory inflammation storm and reduce inflammation. So there I think repurposing is there. Evidence is not so important, but in the practice we can definitely look into, as madam has suggested, that it can be repurposed in certain conditions. So overall I think the discussion is very well done. Thank you very much. I think you are the great speaker at various forums, and first time you have appeared on the talk show. I think these talks will be remembered for all the doctors who are listening to this particular episode of talk show. Thank you very much. Thanks
Thank you so much.
the team, team Dr. KK Agrawal, IGCP team, and this whole program is guided by USB. Thanks to the marketing, medical, as well as sales and digital team of USB. Thank you very much. Best
Thank you
wishes. Be
everyone for
healthy.
having me.
Yeah,
Thank you
for
so
each and
much.
every doctor, I think sarve bhi sukhinas santu, sarve santu niramaya, sarve bhadrani pashyantu, ma kasyid dukhmapnya.
Thank you. That was excellent. Thank you so much.